All right. Good morning, everyone. Thanks for a little patience on some audio issues that we needed to get squared away this morning. So my name is Jennifer Furrow. I'm with the Department of Human Services and serve as the lead for our school-based access program, and excited that all you guys are here with us in person today. And we appreciate all you guys who are joining us via Zoom. We're excited to be doing 2 whole days of training this year, and we'll be interested in your feedback on how this format works for you. As we get started, I want to take just a minute or two to introduce some folks, especially for those of you who are here in the room, so that you know who you can talk to while you're here. So from DHS, we have Deb Buffington, and she's with BPI. Also within Bureau of Policy Analysis and Planning, which is where I sit, we have Devin Hogan, who, if you've been on any trainings or coffee hours, she should look familiar. Shannon Brown is also there. Stephanie, do you want to? I don't think we have any other DHS folks with us. You want to? I'm going to give this to Steph for a minute to let her introduce our SSG folks.
Thank you, Jennifer. Okay, from SSG, we have Siva. Everybody knows Siva from coffee hours, trainings. Aaron Link. And then we have our project manager. We have Paula, who's our RMTS MAC cost settlement lead. Becky does a whole range of things on our project. Sherry. Hi, Sherry Moore is, you guys probably talked to her a lot about max capture. And then we have our liaison team here. Gina. There is Gina. She does the Pittsburgh area. Jai does Central PA, and then Maggie in Philadelphia area. Sorry.
Thanks. You want to say hi, Ronnie? Everybody knows Ronnie, right? Everybody knows Ronnie. Okay. So as we get started this morning, we're not doing the typical general session that you guys have been seeing year over year over year over year. We'll be looking at sharing some of our financial histories actually on the SBAP website. We want to make sure that some of that information becomes something that's more available on a regular basis. So that's just one piece we're working towards. Maybe. I'm gonna let Ronnie tell you what she's trying to tell me.
Just want to remind everyone that's online, because we have a lot more folks online than in person today, and tomorrow, that if you have questions throughout, which we will try to answer between each session, if for the folks online, if you could put them in the chat, we have someone monitoring the chat.
All right. So we'll catch the slides up here in a second, and we'll keep moving. So this first session today, we're going to talk a little bit, just some overviews of some updated information, and then the majority of our time is actually going to be with Deb and Shannon talking to you about documentation requirements and oversight pieces of the program. Whoa, how far I think I went too far. All right, so things that happened in 23-24. It's been a busy year. I know that it's been a lot of work, so we appreciate you and all the work that you've done. So one of the things that we're really pleased with that launched this year was our liaison team. So this was something to make sure that within your region, you each have an individual that you know is available to you as a first point of contact in case you can't get to one of the the others of us. We completely redesigned the quality assurance review process. So some of you have already participated in that. And of course, we're getting ready to kick off for the new school year. We issued an updated handbook. It went live on the DHS website on Monday, and it is live on the School-Based Access Program website as of Tuesday. So I know you guys have been waiting a while for that one, so it is there. Other major impacts on us in the last year, we've got the results of the review that was conducted by the OIG on Pennsylvania's School-Based Access Program. What you have mostly had to deal with from that is that record retention back to forever and a day. And we are still working through some of the final pieces of that process. The OIG always asks for a whole lot of money. And then at the state level, we work with CMS to reach what is a reasonable figure in terms of anything that needs to be paid back. So that's why we haven't given you the green light to get rid of all those old records that you might still have. But keep your fingers crossed. Hopefully that will occur within the next few months. So the other big thing that occurred for us this year is that we received a technical assistance grant from CMS. And we'll talk a little bit more about that grant today. Man, this thing's touchy. Apparently I need someone else to move my slides because I'm not doing very good. It's going through. All right. Gosh. So we did have some delays that occurred because of the transition. We all know that. The school-based access program is ultimately a really big machine. And when you make a change like we did, you're bringing that to a halt and then you have to start it back up again. So we were able to kick back in with direct service interim payments flowing in January. We were able to get access to 2 timely filing windows through the course of this 23-24 school year in order to make sure that we captured those services that we had delayed entry on. Back payments restarted. You should have received, if you reported costs and completed your CPE for July to September of 23, then you should have received that payment already. And the October to December MAC is moving. So hopefully within the next month, you should see that claim payment as well. Let's see if I can actually make it go 1. Ooh. All right. So some of the items that came up as part of the OIG review are things that you have seen that have caused you a little bit of pain in some instances this year. But it impacted beyond just the record retention aspects of the random moment time study. And so that's why you saw that narrowing of available position titles, looking at how we use or don't use vacancies and work schedules. And then also looking at direct service and transportation claiming together. We tightened some things up there as well in anticipation of changes that we have coming with specialized transportation. So there could be other changes that happen as a result of this report, but we will keep you posted as we move forward. And we're going to be looking for a lot of input from you all over the next probably 6 months. Also, big thing that occurred recently was the new guidance that came out from CMS. So prior to May of 2023, we were operating this program on documents that were issued in 1997 and 2003. And it isn't that CMS hadn't changed their minds about things over the years, but none of them were in hard guidance. And now we have that hard guidance. So within that, there are pieces of it that we are required to come into compliance with by 2026. And so as much as I would like to tell you that things are like settled down and everything's going to be like quote unquote normal, we don't know what new normal is going to look like. There will be some changes that impact the program as a result of the guidance. So one of the major pieces that came out of this guidance was the encouragement of all states to expand Medicaid access within school-based services beyond just students with IEPs. And so this had been really kind of an optional thing. It's really not at this point. CMS wants to see that the states are allowing for participation of students beyond just those IEP kids. So there are certain aspects of the guidance that provided clarification. That included the definition for specialized transportation, the quote unquote inactive time study, July to September, that's gonna go away. Notification and response windows for those random moments will be changing. There are some potential changes coming to calculation of IEP ratios and how those numbers are arrived at, and documentation requirements as well. So CMS, once they issued the new guidance, then they also put out a notice for grant funding. There were 18 states that were each awarded $2.5 million to be used over the next 3 years to expand their school-based services. And also a component of that is making sure that we come into compliance. So this is what's called a cooperative agreement, which means that CMS has significant involvement in the process as we make any changes to the school-based access program. So what should you guys expect from this grant? We've been pretty quiet about it at this point because even the information from CMS has been a little, well, it's been minimal up to this point, and we're really just trying to get things started. But the main thing that you should expect to see is outreach. Because we have so many LEAs in Pennsylvania, the best way for us to get your feedback is through surveys. I know you guys don't like all that stuff in your inboxes. However, we really, really need your responses because those are going to be the first step of driving what we do with this grant and how we change the program moving forward. So one of the other pieces that we built into this grant were some professional development opportunities for local education agencies. So the national organization that supports Medicaid and education, which is NAME, National Alliance of Medicaid and Education, when you are a member of NAME, you have access to a wide variety of webinars and resources that are specifically devoted to what you guys do on a daily basis related to the school-based access program. So as of today, when you look at the registration page for this training, there's a link. And we will be providing a membership a single membership. So you want to identify one person in your LEA, and they will be provided with a membership to name that will give you the access to those resources. And I'm going to pick on Rosemary right now because she's here. But if you want to know if there's value in name, talk to Rosemary. She was with us at the conference last year, and it's really an opportunity to connect with other people who do what you do, see what's happening in other states, and just get more information about what Medicaid can look like in schools in different places. So we're excited that that's going to be available to each of you. And that's at no cost to you. That's covered through the grant. So as I mentioned, the data that we collect through these surveys and any other outreach that we do, we will be developing plans to look at additional provider types that we might need to add, or additional service types, modifying the service types. Obviously, a big piece of the spotlight, if you will, right now is on student mental health. And that's not an area that we currently capture well within SBAP with our existing providers and services. And so, but we're going to be looking to you to provide us some information about who you are using to provide these services and how we can help you to get more reimbursement for those. So with that, I'm going to hand this over to Deb and Shannon so they can talk to you a little bit about documentation.
I'm going to give you this clicker, sorry, if you don't mind. You're here. All right, I got to remember to talk into this microphone. Good morning, everyone. My name is Shannon Brown with the Department of Human Services, and I work with Jennifer in support of the school-based access program. Specifically, my main focus areas are working with the oversight and monitoring portion of the program with cost settlement as well. And so this is an area of fall training that we wanted to do a little bit differently this year as well. In past years, we've kind of treated the documentation requirements and oversight and monitoring and what BPI does with their audit program as separate components. We thought it might be helpful to show how all of these areas kind of work together and just kind of flow. And as you know, starting with the key area of documentation and making sure that the documentation requirements are met and how that can then help you in these other areas, and just sort of how it all ties together and how they're all related. So Deb and I are gonna bounce back and forth here a little bit. I'll start just by giving a general overview of program documentation requirements. Then we'll look at the documentation from a BPI perspective, and then move through some of the other areas of the compliance portion of the program. We gotta use the clicker. I don't know. I'm seeing it here. Oh. But now it's not gonna let me click back and forth. It's not letting me move. I'm trying the arrows on the keyboard and this.
All you gotta do is application.
Okay, so I can use the clicker or the keyboard? Okay, excellent. Thank you. All right, we'll move forward here. Okay, so beginning with documentation requirements. This is information directly from our handbook about documentation requirements, just a couple general reminders of the purpose of retaining documentation. And that ultimately it is the responsibility of the LEA to maintain this documentation. You're not seeing it on the webinar. Interesting. Where is there a share button? that you- Yeah, we'll work on getting the presentation shared back to the webinar. My apologies. I don't follow along with the handouts. We'll keep moving here. Is that good? Okay. All right. Again, at minimum, the LEA must maintain the following documents that you see here. Obviously, IEP, parental consent forms, the MedAuth forms, copies of licenses, certifications, documentation that verifies the service providers meet qualifications. All of that information should be kept. Medical records, evaluations and assessments, and student service and provider attendance. Additional documentation requirements, again, straight from the handbook. All of this probably very familiar to most of you. Just wanted to provide a visual reminder. When documenting service, providers, I'm sorry, I should have put a transition in there. So I'm going to turn it over to Deb now. And again, we're going to look at documentation requirements, moving into what BPI is looking at as far as their audits. Deb? I can click slides. It's helpful.
You just hit that.
Yep.
Okay. The School-Based Access Program, or SBAP, is one of many areas that fall into the purview of the Bureau of Program Integrity's monitoring for the potential fraud, abuse, and waste by medical assistance providers and recipients. Documentation is key to providing services. In order to document the service offered proficiently, the provider should ensure that they are answering these 5 questions when they are documenting the services they provide. The provider needs to document in a way that supports the need for the service to show that the service is medically necessary. The regulation 55 PA Code 1101.51 and the School-Based Access Program Handbook are essentially considered your billing guidelines. They require that your provider documentation fully discloses the service being provided. If the documentation doesn't support the service, then you ask, why is the service medically needed? The documentation should provide a complete picture of what the provider did with the student. The more information that is provided with the documentation, the easier it is to determine what additional services might be needed. When documenting, if the log would just say, monitoring the student, how does anyone know what the student was being monitored for? An example you could use could be monitor the student for seizure activity. If there was no seizure activity, none noted. If there was seizure activity, what happened? What steps did the staff or the nursing staff take to take care of that child? What happened after the seizure? Those kind of areas of documentation are very important. The documentation examples in this slide are considered insufficient. The statements do not elicit enough information. The OT example, how did the student trace and copy their initials? Were they in the correct order? Were they backwards? Were they legible? For the social worker, why does the student need anger management? What sort of episodes lead up to the anger outbursts? Is there something that the staff can see before the student has an episode of an outburst that they can intervene? What was done to help with the anger management, and was it successful? If it's not successful, then something else needs to be done, and that should be included in the documentation. If it was successful, that should also be included. For the PCA, what did the PCA monitor? Assisted with what? Somebody should be able to look at that and see what the PCA is actually needed for. These examples and those continued on the next slide are considered sufficient documentation. They paint a better picture so you can see exactly what was done and how the student participated. A PCA working with the student for the first time can tell from the documentation that they need to assist the student in preparing his food. They need to monitor him while he eats and might need to offer hand-over-hand assistance. Again, these examples emit just enough documentation so that you are able to see what was done and how the child reacted. Why did the student present for the speech or for the service or treatment? It was speech therapy. What kind of treatment did the student receive? Worked on matching multiple meaning words with two definitions. What was observed during the service or treatment? The student retained what was previously worked on with 55% accuracy. What was the outcome during the service or treatment? He or she participated well and is progressing. Is follow-up needed? The student is making progress, but therapy is still needed.
Yep. All right. So now we're going to move on to a look at quality assurance reviews. And as Jennifer had mentioned at the beginning, this is an area of the compliance portion of the program that has been revamped and reworked going forward, starting with this year. So our quality assurance reviews are conducted by our partners at SSG, and those are happening on an annual basis. They are working directly with our LEAs to ensure the compliance with the program requirements. Each year, a minimum of 15% of LEAs within each region will be selected to participate in a QAR. So our program liaisons in each of our regions will work with 15% of the LEAs in their region to conduct a quality assurance review with those LEAs. As it mentions here, in person whenever possible, just to get an opportunity to really make connections, work with the LEA more directly than in a virtual environment. During the QAR, staff will meet again with DHS vendor, and in some cases, representatives from DHS will join as well. There'll be an opportunity to ask questions. It's really a conversational type of a process where you'll sit down. You'll walk through a question and answer style interview and look at documentation and within the program and what you have on file. They'll talk about your processes for retaining information and give suggestions on areas for improvement if things are needed. You'll have an opportunity to ask questions about anything you may have concerns about in really, just that one-on-one type of environment. It's not designed to be punitive or punishment in any way. It is purely educational for the LEA, assistance in order to, with the ultimate goal of helping you have your documentation as tight as possible, and again, with the ultimate goal of getting you the most reimbursement for the program as possible. After these reviews are completed, after the in-person portion is done, you will receive a written report summarizing your visit with for the quality assurance review, letting you know opportunities for improvement, and how just a written overview of how things are going for your program. And those quality assurance reviews then ultimately set you up for success should your LEA be selected to participate in the oversight and monitoring program, which is another way that we ensure quality, ensure compliance within the school-based access program. Again, this program slightly different from the QAR, not conducted in person, but we do a random selection of participating LEAs each year are selected to participate with our oversight and monitoring reviews. They take a look at all of the documentation that is required for the cost reconciliation, cost settlement process. The review walks through each area of cost settlement, looks at that documentation, and ensures that the LEA has provided accurate documentation to support the claims that were created through cost settlement. Retaining documentation from the annual cost settlement provides the LEAs with the documentation that they're going to need to participate should they be selected for an oversight and monitoring review. We have over 500 LEAs across our Commonwealth participating in our school-based access program. Each fiscal year, we'll select approximately 10% of those LEAs to participate in our reviews. Upon selection, you would receive electronic communication via email from the department, in addition to communication from our vendor SSG, letting you know you have been selected to participate. That information provides you everything you need to know to get started. It'll explain how to access the systems, where you need to go to upload information to provide that for our reviewers. And there's training also that goes along with that. SSG provides really nice webinar-based trainings where you can they'll provide you an exact overview of what the process looks like for our oversight and monitoring reviews. You'll have an opportunity to ask questions as you go through the process. During the trainings, you can ask questions, and then as you're going through the process of uploading documentation, if you have questions, concerns, there are individuals available to answer your questions and help you complete the reviews and get them all the information that they need. Yep, next slide's going to be you. So ultimately, again, the goal of these oversight and monitoring reviews is to provide oversight for us to ensure that your programs are operating efficiently, accurately. We want to make sure that you have the proper documentation to support those costs. There are cases where if we're unable to get documentation that is required from an LEA, if there was a mistake made or accurate documentation was not able to be provided to support the costs that were claimed, recoupment may be required, may be requested. And if it comes to that, you'll receive a letter explaining where, walking you through where the areas on the report were, where there were discrepancies and differences, and if restitution is required, it provides instructions on how to do that and what that process is. There are appeals rights. If there was a mistake made, there are opportunities to correct those things. before any restitution would be paid. Again, I feel like this is an area of the program where we're really trying to work with LEAs to ensure that, like, earlier in the process, if the documentation is kept accurately, and through the quality assurance reviews, participation in those, it really allows you an opportunity to have yourself well prepared and well positioned should you be selected for one of these oversight and monitoring reviews. It just makes that process that much easier for you. And with that, I'm going to turn it back over to Deb, and she's going to talk about BPI and their audits.
Thanks, Shannon. The major role of the Bureau of Program Integrity is to combat fraud, waste, and abuse of medical assistance services. The School-Based Access Program is one of many different sections that are found within the Bureau of Program Integrity. In order to prosecute for fraud, it must be proven beyond a reasonable doubt that the person or persons intended to commit fraud, meaning that they knew that what they were doing could result in an unauthorized benefit to themselves or other person or entity. One of the ways that we look for potential fraud, abuse, or wasteful practices is by conducting audits. In order to conduct an audit with BPI, the cost settlement process must have been completed. For this reason, BPI audits are retrospective. The first type of audit would be the quarterly audit. Moved ahead, bumped it a little. This is a much smaller review that only encompasses 3 months and is done 4 times per year. Statistical software is used to choose 3 school districts, and then 3 students are chosen from each of the 3 school districts. While this is considered a smaller review, it could become a larger review depending on what is found. The second type of audit is the yearly audit. The statistical software is again utilized to choose a sample of school districts that will be reviewed. We try to complete at least 5 yearly audits. This is a much larger review that covers an entire fiscal year. As many as 10 to 15 students could be chosen from a district for that review. Another type of audit would be the proactive audit. This could also encompass an entire fiscal year or just a specific time period. It could include all services that were offered during that fiscal year, or it might just concentrate on a specific area. A proactive review might occur if we would receive a hotline complaint, which must be investigated. In that instance, a specific service could also be looked at. Self-disclosures occur when the LEA, you, come across an error that was made. The LEA should contact the BPI School-Based Access Program Coordinator, which is currently me. We will then check to see if the error or errors involve any paid claims. If so, then we can continue the process of adjusting those affected claims. As stated, it is a legal and ethical commitment to return Medicaid payments that might have been obtained in error. If you do know that there is something that is occurring and you do nothing about it and it is found out later on, that could be considered fraud. The final type of audit is the self-audit. We encourage you, the LEAs, to perform self-audits. You can determine how often and how many records you audit. Self-audits allow you to determine if compliance is being met with no repercussions if you do find errors. Self-audits help to identify incomplete or inaccurate documentation while promoting a commitment to comply with the rules and regulations within the program. Self-audit activities include periodic reviews of service delivery and billing and review of regulations or requirements to ensure that the services are being delivered properly and billed correctly. There are benefits to performing self-audits as well. Identifying overpayments, identifying services that you could be billing for but aren't, identifying individuals that might not be submitting their time correctly. And also, you are doing this review at your own pace. If you do find any errors, you should always check with BPI or SSG to first find out if it was a paid claim in order to determine the next course of action. I have included on this slide a link to the self-audit record review document. This form was developed by Policy and Program Integrity as a tool that can be used by the LEA to make sure that they have all of the documents and records that are required for school-based access program billing. The LEAs are not required to use this form. It's a tool. Let's take a look at some elements of the form. The parental consent form gives permission to the LEA to bill medical assistance for the services their child is to receive. The consent only needs to be signed one time. Another notification form is sent out yearly to the parent, reminding them that they did sign the form, but also letting them know that they can withdraw that consent at any time. To avoid denial of claims, it is important to verify the completion of the consent prior to billing for medical assistance. That is why I highlighted those 3 areas. Those highlighted lines must be in place in order to bill medical assistance. Is it signed by the parent or guardian? Is it dated? Did they put a check mark or an X on the line giving permission to bill medical assistance? All 3 of these items must be in place. If any one is missing, then any claims that have been processed could be denied. The Individual Education Program is a PDE document. Because of that, DHS is not able to dictate how the IEP is written. But be mindful that the recommendations given by the IEP team must also be placed on the MedAuth exactly as they are written on the IEP. The Medical Practitioner Authorization Form, or MedAuth. Medical assistance is the student's health insurance. After the IEP team meets and determines which services are to be recommended for the recipient, those services must be reviewed by the practitioner, the physician, physician assistant, or certified registered nurse practitioner. They then authorize the services requested by the IEP team using the medical practitioner authorization form. This is like the prescription you receive from your physician to obtain certain health-related services, such as medications, therapies, x-rays, etc. All of the items on this slide are highlighted, which means each one must be in place in order for the services to be compensable by medical assistance. Services must start within a few days of the IEP meeting, but the MedAuth must be signed by the practitioner prior to or on the date of service, or those services are not compensable. If services are billed prior to the signed MedAuth date, that would be considered billing without a practitioner's order, and any submitted claims would be denied. The service provider log, or health-related services. Service provider logs are daily progress notes, which are used to provide evidence of the delivery of a covered service. DHS has provided templates of each log. LEAs may opt to develop their own template. However, those logs must reflect the required information that is contained within the DHS templates in order to bill medical assistance. Service provider logs, specialized transportation. In order to bill for specialized transportation, the student must have another health-related service that is being billed on the same day they receive the specialized transportation. Attendance records. Verify that the student or providers were in attendance on the date of service. I have come across a handful of claims that were submitted, but the student was marked as absent on the attendance sheet. A simple mistake, but that claim would be denied. Service provider list. Verify that the provider has a valid license on the date of service. One thing I'd like to remind you of is that when you're sending the records for an audit, Be sure that you are sending licensure that was valid during the time period of the review. For instance, if the dates of the review would be July 1st of 2022 to June 30th of 2023, then the licensure that you're sending should be valid for those dates, not for the current dates. The same goes for first aid and CPR certifications. And also remember that certifications for both CPR and first aid are required. Preclusion and exclusion. Section 5.4 of the SBAP handbook contains information regarding preclusion and exclusion. If an individual or entity is precluded or excluded, they are prohibited from participating in medical assistance programs. Does your LEA have a policy and procedures in place regarding screenings for precluded or excluded individuals? Within SBAP, these screenings would apply to any individual listed on your LEA's direct service and administrative staff pool lists. This would include any individual or entity employed or contracted by your LEA, which directly or indirectly supports any service or item payable by Medicaid. Your LEA should develop auditable documentation to show these screenings are being performed. A self-audit performed periodically in this area would assist in maintaining compliance with these screenings. There are many reasons why an individual or entity could be precluded or excluded from participating in the state's Medicaid program. The provider could be penalized for allowing an excluded individual or entity to obtain payment for services. Besides having to pay back any monies received, they could be imposed civil monetary penalties of not more than $10,000 for each item or service. Providers who participate in the school-based access program are required to screen their employees prior to their hiring and then every month thereafter to determine if they have been excluded from participation in Medicare, Medicaid, or any federal health care program. The MediCheck list identifies providers and individuals or other entities who are precluded from participation in the medical assistance program. The department makes its best efforts to include all federally excluded individuals and entities who practice in Pennsylvania on the MediCheck list. The list of excluded individuals or entities, or the LEIE list, is a database maintained by the Department of Health and Human Services Office of Inspector General. It identifies any individual or entity that is excluded nationwide from participating in any federal health care program. System for Award Management, or SAM, is an e-procurement website that is with the U.S. government, and it's maintained by the General Services Administration. And the 3 websites are included on this page. Now I have some frequently asked questions. The American Red Cross Certificate of Completion for First Aid CPR AED says it is valid for 2 years. If the training was completed on February 20th of 2024, wouldn't that mean that their certification expired on February 20th of 2026? So the American Health Association certifications explicitly indicate that certifications are valid through the end of the month of expiration. So when an explicit expiration date is not provided, beyond month and year, the guidance from American Health Association is used for reviews. In the example, February 28th of 2026 would be the expiration date used in the review. If there was a fully online CPR first aid course and that course did not require an in-person component for certification, would the certification be considered valid? Certifications in cardiopulmonary resuscitation, or CPR, must include a hands-on skills assessment for the SBAP program. Fully online CPR courses do not result in valid certifications for the provision of personal care services, consistent with the Office of Childhood Development and Early Learning. That is not to say that a family member, a friend could not have an online certification for CPR. Just know that within the school-based access program, you must have a hands-on certification along with any other online part to be considered valid. If a student requires an over-the-counter medication, such as Ensure, which Ensure is not really a medication, but we're using it as an example, how would we document the medical necessity of that service for the school-based access program? Medication administration is a covered nursing service within the school-based access program, as outlined in section 3.4 of the school-based access program handbook. In order to document the medical necessity of medication administration, the health-related service must be identified in the special education student's IEP and on the associated medical practitioner authorization form. This is true for over-the-counter medications or supplements like Ensure as well. If the student has a doctor's order for the Ensure, or if the student is to receive the Ensure during school and the school wants to get reimbursement for that service, it must be included in the IEP and the MedAuth, and it must support the medical necessity of the medication or supplement administration. Then that medication administration is billed per occurrence. Are there LEA designed medical practitioner authorization forms? Are LEA designed medical practitioner authorization forms and or provider service logs acceptable documentation for school-based access program? As stated before, the forms that are provided on the school-based access program website are specifically designed to ensure that they include all of the required information that is needed to bill for medical assistance and also in the event of an audit or review. While it is acceptable for LEAs to develop their own templates, those templates must reflect all of the required information contained in the DHS templates. To have DHS review your LEA design forms for compliance, you can send a copy of your form to the resource account, which is listed on the page here. A few things to remember. You can reduce risks of mistakes by being prepared. Be sure to stay up to date with changes to the program as well as any changes to the rules and regulations that govern the program. Train your staff to maintain compliance. Take advantage of any training opportunities and encourage your staff members to do this as well. There are a wealth of learning opportunities that are out there. Coffee hours with SSG are a wealth of information where you can ask questions. You can ask us questions. We're here to help. Routinely conducting self-audits is also a helpful tool. Please reach out to BPI with self-audit questions and or BPI-initiated reviews or audit questions. Previously, we had said that you could reach out to me for any compliance questions, but in order to make sure that we give consistent answers, like I said, any self-audit questions or BPI-initiated reviews or audit questions can come to me, but we ask that you reach out to the resource account for all other school-based access program questions. If you're unsure how to write the IEP, you can also contact your special education director. And that comes to the end of our presentation. As you can see, there's a link for a survey at the bottom. Please fill out the survey.